Hello, today's topic is all about cervical cancer. Cervical cancer is a type of cancer that starts from the cells of the cervix. Now, the cervix is the narrow part of the lower uterus that produces the cervical mucus that helps sperms travel from the vagina to the uterus. It also opens during labor to allow the baby to pass through the birth canal. Now, cervical cancer is the fourth most common cancer among women globally. Now, with an estimation of 6,000 new cases and 342,000 deaths in 2020, according to the World Health Organization. Now, cervical cancer is a malignant tumor. This means it can spread to the other parts of the body. Now, cervical cancer is linked to human papilloma virus type 16 and 18. Now, the HPV is transmitted through sexually contacts. Now, the World Health Organization global strategy to eliminate cervical cancer is all about the 90% of the girls should be fully vaccinated by the age of 15. The 70% of the women should be screened with high performance tests by the age of 35 and again at the age of 45. The 90% of the women who are diagnosed of cervical cancer should receive treatment. So this is a 90%, 70%, 90% the World Health Organization global strategy to eliminate cervical cancer, the Vision 2030. Now, what are the risk factors of cervical cancer? There is no known cause of cervical cancer. However, there are predisposing factors such as the HPV, the human papilloma virus, the multiple sexual partners, having weak immunity, being obese, having other sexually transmitted disease such as the syphilis, chlamydia, and all other sexually transmitted disease. This may predispose one to have cervical cancer. The other thing is all about smoking, having family history of cervical cancer. Now, what are the signs and symptoms of cervical cancer that one need to be aware of? One is the increased vaginal discharge, bleeding between or spotting following periods, vaginal bleeding after sex, weight loss, having chronic pelvic pain, pain during sexual intercourse, bleeding after menopause. These are some of the signs and symptoms that one needs to be aware of to seek medical attention for the doctor to take the history and do examination and send for the investigations. Now, how do we prevent cervical cancer? One is the primary prevention. In primary prevention, we're going to talk about the human papilloma virus vaccination that is given at the age of 10 to 14 years of to girls and even boys. 2 doses, 6 months apart. Use of condoms, limiting the number of partners, lifestyle changes such as avoiding smoking, male circumcision. Now, in secondary prevention, we talk about screening, the human papillomavirus DNA tests, doing the pap smear, biopsy, visual inspection methods, verific ultrasound, and magnetic resonance imaging. In tertiary prevention, this involves treatment of various stages of cervical cancer. It can either be earlier cervical cancer, locally advanced cervical cancer, late stage. So the treatment can be surgical, chemotherapy, radiotherapy, chemoradiotherapy, palliative care. So these are some of the treatments that are going to be given depending on the stage. Now, this is the cervical cancer awareness video. Kindly share the video with anyone you think she or he might be benefit from this health video. Thank you.